think, we get a lot of questions about, once I get the vaccine, can I stop wearing my mask since I can't get COVID? And I think there's, first of all, it's cold outside, and these masks are so comfortable, as Tracy's child pointed out to us the other day. And now that I don't have a beard, my face is going to get cold. But um, no, the truth is first of all, as we said, the vaccine is not 100% effective for symptomatic COVID disease. So there's still, a smaller than before you get vaccinated chance, but still a chance that you could still get full COVID disease. I think another thing to remember is that these studies really studied who got symptomatic COVID disease, and what they didn't do was see whether there were still low levels of virus infection, these kind of asymptomatic infections that we talk about, that we know have driven the spread of COVID. And so, it's actually really important that in the initial stages, as we are starting to vaccinate people, that people who are vaccinated still absolutely do wear their masks. And it's really going to take a lot of time until we have enough people vaccinated that we can kind of drive this herd immunity that we keep talking about. And then we don't need to worry about that, because the virus will really not have enough places to kind of live and be transmitted. And then there's the whole topic of layers of protection, which you guys are both big fans of. So I'll just throw that out there and let you riff on that.
Yeah, and I think to your point about masks, Steve, as you pointed out in The Princess Bride, they kind of predicted that everyone would be wearing them eventually. I don't know about the terribly comfortable piece, but definitely was correct.
Oh my God.
So, I think Steve, you bring up a great point, which is the study was designed to see who got COVID disease. They would have had to swab everyone, on a regular basis to see who actually maybe had asymptomatic infection, and they didn't do that. So we don't know. We are assuming that it's less likely will spread, but since we don't know, and we also don't know, there was that small percentage of folks who didn't develop the immune response, and they still ended up getting infection. And so it's not 100%, and we don't have a reliable test yet to say with antibody that after you vaccinate, we can run a test and be sure that you've got immunity. So, that day may arrive at some point, and I think there's a lot to be hopeful that after you get the vaccine, that at some point you'll be able to say, you probably don't need to wear the mask anymore. But the layers of protection is important, because remember, what has controlled it, particularly for Jefferson County, is really good attention to social distancing, wearing a mask, washing your hands, avoiding large gatherings indoors, all of these things adding up. And at this point, the vaccine is, yes, the next layer that hopefully is going to basically kind of supercharge all the other layers and get a bigger drop. But it is just one item. And particularly until we have enough people around who have that vaccine, then we need to keep up the protections that we've got.
Yeah, the only thing that I would add there is just to highlight some of the things that we still don't know, either about the coronavirus natural infection or the vaccine related immunity, which is that we really don't know how long the immunity lasts. Right? If we've been paying attention to the news, there are certainly case reports of people who get COVID more than one time. And what that means to me is that any kind of an immunity that was born from the first infection waned, allowing a second infection to come on. This study absolutely did not answer that question. How long does the immunity last? Does this mean that I'm protected in some way from developing severe COVID for the 2 months that were studied? Is it 6 months? Is it a year? Is it forever? Among the vaccines that we know about, we have boosters for some. We get the flu shot every year. So there's lots of variability here, and it's just still too soon to know. So I would echo again the layers of protection. This is just another layer and another tool that we have at our disposal to take this on as a community.
You also bring up a good point of why, even for people who had COVID infection, there's going to be the recommendation for them to get the vaccine, because there is the possibility that your immunity is going to wane, and maybe the vaccine immunity might last longer than the natural immunity. So, so get the immunity, actually, ideally with the vaccine, and never go through that whole disease and complicated illness piece, and avoid that piece altogether. But even if you had to go through the illness, probably still gonna recommend that you get the vaccine at some point.